Just go right to the first slide, Sean. So, first of all, good evening, everyone. Welcome. We all heard the announcement on Friday from the CDC, and I thought I'd talk a little bit about that. Um, the CDC, as you know, announced that it was going from 6 foot social distancing to three in its recommendations. Since that time, and actually prior to that time, we heard rumors that it was the CDC was leaning that way. So we've been bringing furniture back into classrooms and putting them and getting them ready. And then once that announcement came out on Friday, we certainly kicked that up a notch or two and started bringing furniture in quickly in large numbers. And then we're also cleaning and storing that furniture and preparing to start taping the classrooms for the new distance of 3 feet. Um, First thing that has to happen is the New Jersey Department of Health has to revise their recommendations to align with the CDC. Now, during this pandemic, the entire time, we've noticed a pattern. When there's been a change in the CDC, the New Jersey Department of Health follows. They don't follow immediately, but they pretty consistently have followed. The first one that came to my mind was when the CDC decided way back in, I think it was early September or late August, that it was the guidance, both New Jersey and CDC guidance said that we had to take the temperature, or recommended we take the temperature of everyone coming in the building. We bought all the thermometers and the extra PPE, and principals made plans all over the district on how to do that because it was quite an undertaking logistically. And then CDC changed their guidelines, and then shortly afterwards, New Jersey followed. So we are anticipating that that happens again. When it happens, we're not sure. Our local health official, Kevin Sumner, was in a meeting today with the Department of Health. They discussed vaccines, and they were not prepared to say, they were reviewing, but were not prepared to take a position on the 3 foot social distancing, the decrease from 6 foot to 3 foot. And as I said before, we fully anticipate that New Jersey will follow, but we have to wait until that time comes. In the past, it has not been a long period of time. Next slide, please. I think you skipped one. There we go. Um, so the CDC guidelines specifically targeted elementary schools as students that should be 3 feet apart. In the middle schools and in the high schools, they were they were concerned with cohorting as well, depending on the community transition. So in the middle school and the high school, students should be at least 3 feet apart in areas of low, moderate, or substantial community transmission. In areas of high community transmission, middle and high school students should be 6 feet apart if cohorting is not possible. So what is a cohort? It's not our A and B cohort. According to the CDC, the cohort is a distinct group that stays together throughout the entire day. And then here's the question for New Jersey Department of Health, as well as our local health official: over the course of any predetermined period. So we have to figure that out. The middle school, 7th and 8th grade, to me looks like a cohort group. They do have some interchanging of classes. The high school, I do not think we'll be able to find any cohorts in the high school. As you know, children travel full day every day with a different schedule. If at most they have 2 or 3 classes together, but for the most part they follow different schedules. So that remains to um, be further defined, and we'll be looking for more guidance on that. And again, I'm sure this is going to happen quickly, sooner rather than later. Next slide. So what could we expect uh, after if when New Jersey Department of Health aligns with the CDC and allows us to have 3-foot social distancing? We will be able to provide at the elementary school level, K-6, 5 days a week, half-day instruction for all students. We've been setting up model classrooms for the last week, last couple of days, and it appears that we will have enough of student desks, and the elementary can fit enough of elementary school desks in a classroom to fit all of our current capacity at the elementary school level, and that's if everyone decided to come back. So we're very confident about the K-6. The 7 through 12, again, we have to know more about what New Jersey and our local health department and what the CDC means by how strict a cohort is. So we'll be looking forward to identifying more information about that. Um, Next slide, please. I wanted to point out at the last meeting or the meeting before that, I indicated we were looking into full day in-person instruction for the fourth marking period. The pandemic teams met, the principals met with the pandemic teams as well as with themselves, and the cabinet. Um, they were directed to go back and look at what the schools would look like if we went to full day um, sessions. Unfortunately, if we move to 3-foot social distancing, that compounds the problem, because uh, the CDC's recommendation as of now, if it was adopted in New Jersey, requires 6-foot social distancing at lunch and outside any of the um, outside the classroom activities, outside the cohort. So lunch was our problem, staffing it, holding it, having the space, and of course all those problems were compounded with the weather. There were other staffing problems having to do with supervision of children, again at 6-foot social distancing, which spreads them out all over the school, and then being able to have our staff have a lunch, which is required in any job. For a full day job, you're required to have a lunch, and even having the space to provide that. So unfortunately, although we did examine it, each school's pandemic team met, the cabinet met, and the principals met with the cabinets after their pandemic meetings, and we at this time there'll be no we cannot offer full day in-person instruction for the fourth marking period. For September 2021, I get a lot of questions about that. We are planning for full days, 5 days a week of in-person instruction for everyone. We don't know how to plan any other way. Every child, we are planning right now, every child to have a full schedule, full day schedule. Busing schedule follows that. Our cafeteria setups, everything, our staffing is set up for a full day of instruction for September. What happens to the pandemic between now and September? Um, I, I don't think anyone really knows. I can say on the positive end, um, we are getting vaccinated. We all, thousands and thousands of people are getting vaccinated, and we have a positive outlook for September. So we're hoping and planning for full day, 5 days a week of in-person instruction in September. Next slide, Sean. Um, Next one, I'm sorry. So the New Jersey Department of Ed, I just wanted to go over this one more time. The New Jersey Department of Ed recommends that we follow the LOH, that's the local health official, because they have the ability to implement guidance based on the local circumstances. So our New Jersey Department of Education encourages and recommends that we bring our health official in on any discussion and find out what their recommendations are because they're the trained professionals. The guidance is a hard copy and is subject to interpretation. CDC, these are the new guidelines released by CDC. They also highlight a section, and we just lifted this right out of it, monitoring cases and making decisions about in-person instruction. And it says, in collaboration with the local health department, decisions should be combined information about levels of community transmission with school-specific factors, such as the implementation of prevention strategies. Of course, those prevention strategies are masks and social distancing, etc. Next slide. So again, just to repeat, I think I've said this just about every meeting since June or July, but it's worth repeating and understanding that in making decisions about the structure of our school day and whether schools open or close or whether we're on hybrid or 5 days a week, whatever our decisions are, we follow the guidelines from the New Jersey Department of Health and the New Jersey Department of Education and the federal government. So we follow the federal and the state guidelines, and we confer with the Bridgewater Township local health official. That's Kevin Sumner. And he has guided us throughout the pandemic. And I have a lot of respect for him. He never waffles on his decisions. He's professional. And he says what he means, and he means what he says. And he has guided us throughout this pandemic, has been a great assistance, and he is a professional and has been with us each step of the way. And by the way, I want to congratulate Kevin because he's been reappointed for last Thursday for a 2-year appointment, and he'll be with us for another 2 years. And yes, I don't want to fail to say that I'm well aware that Kevin Sumner and the CDC and the DOH are only recommendations, and that the superintendent makes the decision. The superintendent alone makes the decision about the structure of the school day. But I also think that people should keep in mind that with 8,600 children, 1,200 plus staff members that I have to make a decision about, that be assured that I will rely on the state and the federal guidelines, and I will confer with Kevin Sumner, our local health officer, and make our decisions with professional advice. I will not step out of and make advice based on the local on a headline or an editorial in a local news outlet or Facebook, or count up the number of emails. The most professional and responsible decision I believe we can make as a board and I can make as a superintendent is to follow the professional guidance, the official guidance, state of New Jersey Health Department, federal health department, and our local health official. And that's what we've been doing, and we will continue to work in that vein. Hopefully those guidelines are relaxed a little bit and we go to 3 feet, and when that happens, we will follow suit. Next slide. I just thought I'd throw this in here as one of the examples as to why we have to check with our local health official. For example, the color codes for CDC are different than the color codes for New Jersey Department of Health. And the CDC and the NJDOH also use different metrics. to determine transmission rates. Now, transmission rates have a direct impact on contact tracing and on how we operate when we come to cohorting and 6-foot social distancing versus 3-foot or anything else of that nature. So it's important that we have some advice on the differing. So the CDC specifically refers to a different set of circumstances if the transmission rate is high. The question is whether the CDC's transmission rate or metrics for high is the same as New Jersey's is for high. And these are some of the things that the Department of Health, New Jersey Department of Health, and our local health official has to determine before and then recommend to us what these what the actual interpretation is. Next slide. I have my office got a lot of questions about staff vaccinations. We're happy to report that in an effort led by the mayor, we have the Atlantic Health System is vaccinating our staff. At the county level, the Somerset County Health Department is also stepped up and has contacted us, and they are vaccinating staff. And then we have to give a shout out to a volunteer organization, the Vaccine Angels, I understand they call themselves, but I met a staff member just the other day who proudly said they just got their first vaccination because they had their name on the list from the Vaccine Angels. So it's a group effort, and I think that over time we will definitely, I'm sure by September, have a fully vaccinated staff. And then the last slide, I know that a lot of the virtual parents are waiting for a survey. The survey will go out to virtual and hybrid parents about their intention for the 4th marking period as to whether they would like to come back as full-time, not full-time, but as in-person hybrid or remain virtual, or if anybody on the hybrid wants to go to virtual. And that's it for my FAQs. Does anybody on the board have any questions?
Tom, I had a quick question. Obviously, everyone wants the full in-person for September, but I'm just curious, I can't help but think, hope for the best, prepare for the worst. If there is a situation where we can't go back to in-person fully, or some students that are maybe immunocompromised or staff aren't comfortable, what are we doing to either improve virtual learning or make the hybrid a little bit easier on our families? Is there anything being done in that direction?
Yes. So while I said we only know how to plan for the full day, it's actually the way we've always planned. So that's how we plan. But we also have to be ready to pivot in case we have to go to hybrid. And we also have staff members working right now to improve the virtual instruction for next year if that is needed. And also, I don't know if I skipped over that slide or not. We will be providing accommodations if necessary next year, even if there is no virtual option offered. But we, as we said, when we went into the hybrid and then the sudden governor's order to provide a virtual or remote, we worked with that for the year. We're not satisfied with the way that works right now, and we are looking to change that for next year. Would probably be in the format of signing up for a virtual school as opposed to your own school and trying to be. So, and they're working on that now. I shouldn't be jumping out in front of the committee, but just some of the ideas would be that to make it work, you would have to sign up for a virtual school, knowing that if you decide to go hybrid or back to full person, you may have to go back. You'd have to go back to your neighborhood school, and it may be a different teacher. That's primarily K-8.
Tom, can you please clarify what you mean by accommodations?
So we've had several calls of people who have indicated that, they've heard me talk about going back to full in person next year. And their particular child has needs that may be physical or illnesses that may not allow for that. Um, and in that case, we would provide for an accommodation, which would
Thank
be
you.
some sort of a virtual setup.
Right. Thanks.
Tom, with the survey going out tomorrow, how is that going to work if we don't know yet whether students will be 6 feet or 3 feet? What it's at? It may impact people's ability to answer. That's why I'm asking.
Yes, we're asking the questions. Why we had a little bit of a delay. We were set up to send the survey out, and then the CDC made an announcement. So we set up a survey that asks you if, as we anticipate, the CDC New Jersey adopts the 3-foot guidance, would you be interested? And if it remains at 6 feet, would you be interested? So the question covers both. We have multiple questions to cover each.
Great, thank you.
Tom, on that note, you had said earlier that it appears we have enough desks in the elementary schools, and I think you were referencing K through 6 to fit all current capacity if everyone decides to come back. Is that, I just want to clarify, that's if New Jersey adopts the 3 feet, not under present circumstances, right?
Absolutely, and thank you for that clarification. So what we did was set up some model classrooms in a variety of schools, and in some of those, for example, in one of the schools I went to, they were able to fit 22 desks in the room, and that class size was only 18. So that's with a 3-foot social distancing. It drops in half with 6 feet social distancing. So I was speaking only in terms of New Jersey adopting 3-foot social distancing.
Okay, and my second question is a little bit harder, I think. You mentioned that we can't do fourth marking period full day due to lunch, but that we're planning for full day in September. Do we have an idea of what will need to change between the fourth marking period and the first marking period next year in order to make that plan a reality?
I'm sorry, Steve, but you froze on me, and maybe just me, but I didn't hear. I didn't
Okay,
hear
no,
your question.
Can you hear me now?
Yes.
Okay. So you had mentioned that we can't do full day in fourth marking period because of lunch, but we are planning to do full day in September as if it was a normal year. Do we know what needs to change between fourth marking period and the first marking period in order to effectuate that change?
Yeah. So the guidelines have to change, and the guidance has to change, and we're optimistic on that because of the vaccination, and hopefully it remains that way.
Tom, lunch seems to be the biggest issue, both for multiple in the pandemic as well as with some other scheduling issues. What are we thinking about there doing? Are there any ideas out there? We have all those covered awnings. Can we throw like pop-up tables there or chairs for kids to eat? We thought, gym cafeteria, auditorium. I don't know. I'm just throwing ideas out there.
Yeah. So our principals in the pandemic teams have reviewed their buildings in a variety of ways and look to be as flexible as possible. If we're talking about the problem that we keep running into is the 6-foot social distancing requirement, even if you have 3 feet, because that 6-foot social distancing is for lunch and any kind of out of the classroom cohorting. So that just, as you know, spreads the numbers, the class is thin, and we don't have enough personnel. We wouldn't have enough personnel to both supervise lunch, eat lunch themselves, and then find the areas. Tents may be of assistance if it doesn't rain. So we have to be careful about setting up a situation where I have to eliminate a school day because of the rain. So we
Bubbles
looked
work too, you know.
bubbles, yes. So there are a variety of issues. Lunch is the most conspicuous. There's some cleaning issues and some staffing issues where staff are now used in between cohorts, sharing computers that need to be cleaned if they're shared and things of that nature. There was a variety of issues. But for next year, back to what Steve's question is, if the trend line goes that we're fully vaccinated staff and hopefully a fully vaccinated community, we are prepared to be full day, 5 days a week. If there are restrictions that are imposed upon us or recommended to us, so to speak, from our Department of Health, we're going to follow them. And then we would have to come back from there. But I think the fact that the CDC is moving toward 3 feet now, and I fully anticipate New Jersey follows, there will only be more people vaccinated in September, as evident by the number of staff we have being vaccinated on a daily basis.
Along those same lines, the pandemic has done something, a technology infusion that, it's like more than we've ever had probably in the last 10 years in the district. Moving forward, how are we planning? I think technology has become a large part. How are we planning to move forward, both, the fourth market, any changes there, and also in the fall? We instituted bring your own device at the high school. Is that potentially going to be being pushed out to other schools, in those areas? How, things like that, just kind of throwing some other questions out there.
Yeah, well, we're looking at being fully one-to-one shortly. And the best way to be one-to-one is to be one-to-one with a BYOD, particularly at the high school level. That enables the district to spend less money on financing a computer for every child, which has to be refurbished every 5 years, or not refurbished, but a new one every 5 years. So whenever someone brings in their own device, that's one less device that we have to give out, and one less device we have to give out again in 5 years. So that recycling through the technology program of the 5-year cycle is what is why BYOD is
Okay.
something that.
Great. So they were looking into it. Okay.
Tom, I wanted to ask
Yes.
about ventilation. I know that's one of the things that appears in the CDC recommendation, and I do know that we have an upcoming assessment of our buildings by our architect. I don't know what the timeline for that is, but I also wanted to know if we're looking at getting expert recommendation, which I guess would be health officials and building specialists, about portable units in rooms and whether that's worthwhile. Of course, we don't want to just throw money away for a technology that doesn't do anything, but if it really does add to the safety of our classrooms, are we looking into that at all?
So the architects that's part of their charge, is to look into and upgrading any ventilation systems, and their charge will be go through each school and look at the mechanics, as what the mechanical systems in each school, and of course that is the ventilation system. So that's a major part of their task.
What is the timeline for that as far as the assessment?
I don't know. Can I get some help on that, Peter? Do you know when we're going to start?
They actually have their first meeting with at the middle school and high school this week. But it is a multiple month project. It's not a quick turnaround for that final report.
If
But
they
it's something
find
that would give
anything,
us information before the fall. Say.
We definitely will have feedback before the fall.
if they find any, I guess, gotcha type moments in their assessment, I hope they'll, I guess, are we letting them know to tell us that first and foremost? You know, I guess how are we handling that? I guess they're, you know, if we see anything that are very, very critical, you know, I'm just wondering how, I haven't heard anything about the assessment, what they're doing, but how is that handled normally?
Well, I basically sent them a model of what I expected them to format, and that they would have to identify each area of concern and then prioritize it 1, 2, or 3, so that priority 1 is immediate. And of course, it's incumbent upon them to tell us about any kind of hazardous situation that's eminently in our way. So that's one of the purposes of hiring a firm to go through each and every building and examine every room, the mechanicals, the structure, etc. So they will be informing us, and they have an obligation to do that, and then prioritizing the state of each of the areas in the building that are identified.
Very quick. Sorry.
Sorry, go ahead, Steve.
Sorry, Gene. Just quickly, I just want to make sure that, with regard to opening in September and the current issues that we have, the pandemic teams are being tasked with looking into that, I assume, and addressing all necessary options.
The pandemic teams. The pandemic teams just met on the full day option, and then they will of course be meeting, as guidance develops and as guidelines come out. As we get closer to the summer, I'm sure we're going to receive more information from the Department of Ed and the Department of Health, and then we'll bring them together to examine whatever changes there are.
All right, thank you.
And I was just going to add a quick thing because I'm also on one of the school pandemic response teams. Dr. Vicard did a nice job with the principals, and basically the message he gave to the principals was there's obviously reasons why lunch isn't happening, because if it was easy to do, we'd be doing it. And so he asked the principals to speak to the pandemic teams, not just about what are the obstacles, but what are some of the possible solutions. And I spoke to a number of the other principals who found that was a really effective way to have the conversation, where it wasn't that we were ignoring the reasons why it was difficult, but trying to problem solve. And for instance, at Hamilton School, one of the teachers said, if we use, I know we always use cafeteria tables, but if we use desks in the all-purpose room and each student sat at a desk, could we fit more of them in there that way? And I said, that's a great idea. And we had an idea about, maybe not a lot more, but maybe that would be something that we could examine for the future as an idea of how to fit more students if we were using a common space at the cafeteria. So a lot of good ideas like that came out of the pandemic response team meeting. So I think that kind of conversation and problem solving will continue.